Welcome everyone to today's Seriti Talks. It promises to be one that is going to be very informative and interactive for that matter. But before I start, then maybe I should just do a quick intro of our speakers for the day. And I will start now with Chris. Vic. Chris is one of South Africa's most renowned communications specialists with more than 30 years of experience in public and private sector consulting. He runs Black, a reputation management company, and is founding chairperson of COVID Comms, a nonprofit network of communications volunteers producing easy to use and easy to understand information products about COVID-19. Then we have Dr. Kane Cross, whose profile I will get to just now. Sorry about that. Dr. Kane Cross is a doctor and a member of the People's Health Movement of South Africa. Her clinical specialization is in surgical oncology, and she currently also works in the COVID-19 clinical service in her hospital. She's an advocate for equity in healthcare and a people's NH1, and has recently engaged with many communities to better understand COVID-19 and COVID-19 vaccines. Then we can commence with today's meeting. Doctor, how do you think the reception overall of the COVID-19 vaccine has been?
Hi, good morning, Lebogang, and sorry for the problem with my audio. Would you like me to put my video on?
Yes, please.
Okay, it's just the host is not permitting.
Just give me a moment, let's see. Please try that now.
Better. Thank you. Good morning and apologies for that. So I think the vaccine uptake in South Africa has been reasonable. We've had a number of problems with starting our rollout related to the type of vaccine procurement, the issues around pharmaceuticals and access. I think when the vaccines did arrive in the country, those that were very enthusiastic queued up to be vaccinated. Mm-hmm. And then we had a little bit of a lag because I think we are now getting to the point where those that are not sure, those people who haven't had enough information or enough opportunity to engage around vaccines are just not coming forward. And so it's another part of our vaccination campaign where we have to be much more proactive.
That's interesting. Do you find that, Chris, that people are much more aware of the differences between Pfizer and Johnson & Johnson? And is there like a preference? And are these actually available at the vaccination sites?
I think there's some discussion around which vaccine people are getting. There seems to have been at some point a perception developing that Pfizer was somehow the blue chip vaccination and the J&J was a second-class vaccination, which is obviously not true. I think the reason for that is that the J&J vaccine is a one-stop, whereas Pfizer takes two. And there was also a perception that because it was used initially as part of a trial, that maybe it doesn't have the same effect as the Pfizer vaccine. But I don't think it's impacting on the take-up. I agree with Dr. Cairncross. I think every time a new age cohort is eligible, we see a big spurt of interest, and it tends to drop off. I think it drops off because people who really want to get into that queue as soon as they can. People who are possibly ambivalent or hesitant tend to wait a little bit. But I think, and I'm sure we're going to pick up on this later. I think there's so many new things about the COVID-19 vaccine that also add to uncertainty, that possibly raise questions in people's minds, and that need to be factored in when we debate the take-up and the rollout. as well as the points Dr. Cairncross has made about availability. That every time there were delays with consignments arriving, I think people who were distrustful became even more distrustful. Every time there were government hiccups with elements of the COVID-19 program, that impacted on people's trust. So there's a trust deficit that I think exists in some parts of society, and there's misinformation as well. We're competing with all of those.
Yeah, and it's very interesting, but Doctor, why do you think there's hesitancy towards the vaccines?
So COVID has been very novel in many ways. So the everything around the pandemic has been open to public scrutiny, to politicization, and to a lot of false information and mythology. And when the vaccines arrived on the scene, I think they arrived partly into that milieu where it's a contested terrain. So some of that is quite irrational questions, such as how was this vaccine developed so quickly? How was it tested? And there are very good answers to those questions. Those are appropriate and relevant questions, and they are good answers. But I think that there is also, as Chris was saying, there is a lack of trust in states and governments, and to a certain extent, the health system as well. So that's not across the board. I think, if you look at South Africa's vaccine, when we look at our surveys, it's not extremely low, those that want to take up vaccines. And I think in South Africa, we have a very small part of the community that's truly anti-vaccine. I think for most people, it's a question of ease of accessibility and access to appropriate information from a trusted source that you can engage with. So social media and billboards can only take you so far. You have to get to the point where you can have a conversation with a trusted person and actually ask your questions and have them answered in real time. And I think that's the next step that we need to be taking.
And that actually talks to COVID-19 misinformation, because there's quite a lot going on. And I don't even know if this statement is correct, but I came across something, I think 2 days ago, where they're saying more than 12 million South Africans have vaccinated. And I just need to quickly check if, Chris, this is true. And if it is true, why is it, I feel like, maybe underreported? Because the underreporting thereof could be contributing to the hesitancy of the vaccine intake.
The figure of 12 million is accurate. And that's a significant number of people. If you think of the state of the public health sector, it's a notable achievement. It's obviously not enough. I mean, if we're to achieve population immunity, we need 70% of the population vaccinated. But I think the advantage in the numbers increasing is it helps to deal with the concerns of people in the middle. I mean, we often discern between people who are vaccine hesitant and people who are vaccine resistant. And as Dr. Cairncross says, the people who are vaccine resistant seem to be in a minority. The people who are vaccine hesitant seem to have what they believe are rational reasons for that. As Dr. Cairncross says, the fact that the vaccine seems to have been developed quickly, which is correct if you think centuries, but I mean, the mRNA technology that was used was developed in the early 2000s. So the technology that's being used has not been developed quickly. But I must say, Rufus, we've also run into situations where people think that you only get vaccinated if you're sick, for example, and by then it's normally too late. We also get examples of people saying that I'm an adult, why must I be vaccinated? Only children get vaccinated. So there are these rumors and stories that develop around the vaccine, which one can engage with. And again, I think Dr. Cairncross is right. We need conversations with people and communities rather than just supplying them with information, because we need to understand why they are hesitant or why they are resistant, so that we can begin to change their minds. I mean, for us in COVID-COM, this is a behavioral change project as much as it's a public health project. We need to change the way people think about their personal health and about public health. And I think that applies particularly to men. I think men go to the doctor much less often than women do. We seem to think we've got this magical ability to heal ourselves. So because we care less about our own personal health and about public health, the take-up of men getting the vaccine is significantly lower than the take-up of women, which says maybe we need to be having conversations among men and with men to find out why there's this particular hesitancy and a lack of personal responsibility around how often you go for a medical checkup, how often you get vaccinated, how often you have a prostate cancer examination, etc. It's a broader problem, and I think that it's one of the lessons we've learned from COVID-19 is the power of misinformation and the loss through not engaging with people. We need to acknowledge that, and we need to build on that as we build a stronger public health system and a stronger society.
Yeah, I guess those conversations are actually very important for us to have, and more so directly with communities, because like we just said, misinformation is just so outrageous at this point. And I guess people just got so nervous that, and there's like a lot of other conspiracy theories attached to this. And maybe this is the part where I will rope in Aaron. Aaron, thank you so much for joining us. I figured that you were having difficulty joining in the meeting, but how is the rollout looking like? How is the uptake of communities towards the vaccine campaign?
In my experience and in our experience as PVC, the rollout has been quite impressive in terms of the uptake of training, what we've done, community literacy training on PVC. And for that, we have worked across sectors to get trainers who will run into communities or walk into communities and have these workshops and have these conversations. Overall, it seems to agree with the general assumption that about 70% of people are willing to vaccinate, and that those who are overtly opposed to vaccination are a small number, not more than 5%. So the uptake is quite successful in that it shows that people are willing to vaccinate in their numbers, and that what is missing is just the mechanism of bringing the vaccination closer to them so that they can be able to enjoy that opportunity of having themselves protected from the virus. So the uptake is high. We have exceeded the numbers we were expecting. And so we're also encouraged by that. But we also hear from these conversations with community that the only stumbling block, what seems to suggest hesitation, is only a matter of how, accessibility of vaccination. That's where the issue is.
All right, thank you for that. Doctor, there has been so many things said about the vaccine, and now I think the latest would be that it contributes to infertility. So maybe let's have that conversation where we talk if that is true, but then also what are the side effects that people should expect when they get their jabs?
Sure, thanks. Maybe I'll start with the side effects. So, first of all, I think we need to put the vaccine side effects in the context of the impact of COVID-19. So if 100 people are positive with COVID-19, about 10% or 10 of them will end up in hospital, and about 2% will die from COVID, which is a significant proportion of people. If you think about tens of thousands of people getting COVID-19, that is why we see in excess of 70,000 deaths in South Africa, and probably 3 times more than that if you look at the excess deaths. So COVID-19 is a dangerous virus, and in the elderly population, the mortality is around 1 in 3 to 1 in 4 won't make it if they get a COVID-19 infection. So the vaccine is there to promote immunity, so it helps your body to build antibodies before you get infected with COVID-19, so that when your body is infected with COVID-19, it can resist that infection. So it prevents a certain number of people from getting infected, and it also, very importantly, prevents severe disease and death from COVID-19. So there are 2 things people always ask about a vaccine. Does it work, and is it safe? You're asking me about the safety profile, but I think just to say, does it work? Yes, it works. Does it work 100%? No, it's not 100%. So the South African data on, for example, J&J shows that you are 2/3 less likely to get COVID-19 if you've had a vaccine. So it's not you will not get it, but you are 2/3 less likely. But importantly, you are 75% of people who get it will not be admitted to hospital. So your risk of being admitted is much lower, and your risk of dying from COVID is reduced by 90%. And those last two numbers, your risk of being very sick in hospital and dying from COVID, are the ones that really impact on people and also impact on the health system. So does it work? Yes, the vaccine works, though not 100%. It has a major impact on mortality and severity. Are there side effects? Yes, there are side effects. There are side effects which are very common and are quite mild. So many people will get a side effect related to the place where the injection went into their arm, which is some pain and aching around that area. And for 2 to 3 days may experience flu-like symptoms, muscle pains throughout the body, and some people will have headache. We've also had a few people with chills and a high temperature. That will settle in 2 to 3 days. Those are common and mild side effects related to your body mounting a response to the vaccine, building antibodies to prepare for protecting you against COVID later on. Those are common and those go away, and those are not a major concern. Are there some severe side effects? Yes, there are, but they are very, very rare. And how rare, you might ask? They're under 5 per million. And those are some of the severe side effects that you've heard of in the newspapers and in articles that there's been quite a lot of talk about. They are not very common, and I can talk about them a bit more later if you'd like me to. But the important thing is that they're very, very rare.
Right. Thank you for that. Thank you for that, Doctor. I guess we don't overall understand the simple fact that there has to be a causative element of of COVID in the jab, so that your body builds up immunity for it to be able to fight it. And maybe this is the part where I welcome Mabalane. And my question to you would be then, do you think there's going to be a point where the jab is mandatory for each and every South African to take? Mabalane?
We hope we don't get to that point. And the hope is based on the efforts that we currently, as all partners, are putting in place to ensure that there is an understanding of the benefits that the doctor has just outlined. Of course, challenges that come with it, the challenges as opposed to the problems. The benefits as opposed to the challenges. The benefits far outweigh the challenges. So in the main, it is to engage with all of us as society to address the fears that people have, so that getting vaccinated, that we don't even have to get into a conversation. We'd rather be running out of vaccines rather than running out of people who need to take up the vaccination. So what we need to do is to fold our sleeves, get into every house, get into every space, engage with people to deal with their fears. Because I think I've read, in other places, there is issues around anti-vaxxers, but in our situation, in the main, primarily it's about people and their fears. And then there is an element of people are very playful on social media. Of course, they create scaremongering and all of these other things, and other people who don't go out to actually verify some of these things, they just take them as the gospel truth. So coming back to your question, it will be a sad day if we have to force people to vaccinate. It goes against how this new nascent democracy we have, we are nesting, has actually been built upon. We need to get people doing this voluntarily because they see the benefit of why it is necessary for us to do it. So yeah, I think we would not want to get to that particular state, because there are human rights elements that are linked to these particular issues. But we have a problem which is current with us, and we can't have another debate and discussion. We just need to get to do the right things and do them urgently.
All right, okay, thank you for that. Chris, do you think civil society, government, media, do you think we're doing enough? What is it that we're missing that is not getting our people to take the jab?
I don't know if we could ever do enough, to be honest. I think the scale of the pandemic is massive. I mean, so many people have died, so many people have lost loved ones. I think upon reflection, the first few months of the pandemic, government was particularly slow in terms of developing a communication strategy around COVID-19. I think when the vaccine rollout, again, government was a bit slow. But increasingly, we're seeing coherence and cohesion. The government communication and information system has set up something called a National Communications Partnership, which now involves some of my civil society colleagues who are on this call. It involves labor, government, and business through B4SA. And a person has been appointed to coordinate that entire initiative with a very strong focus on public health messaging. So I think you're going to see more integrated work and more targeted work. A lot of it is supplemented by work that Peter Benjamin, who's on this call, his team is doing around what is called social listening. So if you look at the sort of value chain, we've now got a much better sense of what people are saying and why they're saying it. From the statistics, we've got a much better sense of who's getting vaccinated where and why not. The coordination between communication work and vaccine rollout is starting to get better. We're seeing innovation through the pop-up sites that are being organized by provincial health departments, cooperating with the SABC, for example. And then in provinces like Limpopo, which are case studies for how one can do it better, there's been a lot of integration between government, civil society, and community radio, saturating areas to make sure that traditional leaders, community leaders like teachers, taxi associations, etc., are all involved in spreading the message. And then very soon afterwards, you make sure that there's availability. Because to speak to Mabalani's point, there's no point running workshops to deal with hesitancy if I can't get a vaccine, right? So we have to make sure that the rollout of vaccines and the rollout of information is coordinated wherever possible. And increasingly that is starting to happen. The other point worth mentioning is I think we're going to see a more targeted approach, because in some communities, you can literally walk out the door, catch an Uber, and get vaccinated. In other communities, you have to travel 40 kilometers at great expense. So if we're able to target those areas where there's a vaccine access issue and make sure there's access and do whatever communication is necessary, I think we'll start to see spikes in vaccine take-up and a decrease in vaccine hesitancy. Having said that, I think there are always going to be people who resist, I mean, I think they resist science, they resist medicine. I got my first hate email from an anti-vax person a couple of weeks ago, and I can't even begin to have a conversation with that person. They send me images of Jewish people outside gas chambers and say that's what we're doing to people by asking that they get vaccinated. They're the sort of people who still believe Donald Trump won the US election. They believe in white genocide. There's a very, very fundamentalist approach. I think that constituency is the hardest one to crack if we ever crack it. But that's why we must focus on the hesitancy, because if people are receptive and are keen to listen to messages and are prepared to make the journey to go and get that vaccine, that is success. The more hesitance we can deal with, the more likely we are to reach that population immunity statistic.
All right, okay. Thanks for that, Chris. And Doctor, if I have had COVID-19 before, and are there long-term effects? We've seen reports that if a person was saying that they couldn't breathe properly during their phase of COVID-19, they're still experiencing those kind of problems. So are there long-term effects to the virus itself? But then the next question would be that because there's a causative effect on the vaccine, would such a response be expected also if there would be an effect, a long-term effect of the vaccine?
Okay, thanks, Rufima. So yes, there's a condition called long COVID, and we're becoming more and more aware of this as a significant problem. And even younger people who have a relatively mild episode of COVID and don't go to hospital are sometimes experiencing these symptoms. And they range from shortness of breath, so struggling with exercise afterwards or not being able to walk up as many stairs as they did before, to things like sense of smell not coming back even weeks or months later. Quite a number of people are also struggling with chronic fatigue, where their energy levels don't bounce back. And then, as you mentioned, the sort of chronic lung problems. So we have quite a big post-COVID clinic here, which is just helping people afterwards who are struggling with long-term respiratory problems. So COVID-19 not only causes acute severe illness and death in a number of people, but also these longer-term symptoms. So the vaccine, I forgot to mention the issue of infertility earlier. So the myth of infertility being linked to the vaccine, and I say the word myth quite deliberately, started quite early, just as the vaccine was first being rolled out in January, February of this year. And I say myth because there's been absolutely no scientific basis for this assertion that there's a link to fertility. And in fact, the claims came out when people had not even had the vaccine for more than a month, which makes absolutely no sense because you cannot measure fertility in such a small time frame. There's no biological basis on which the vaccine could cause infertility. And in fact, every major obstetrics and gynae association in the world, so the American Association of Obstetrics and Gynae, the Royal College of ONG in the UK, and the South African obstetricians have produced a statement where they categorically agree that there's no evidence to suggest there's a link with a vaccine and infertility. And in fact, this myth is related to a conspiracy theory around population control and has no basis in fact. Yeah. Quite the opposite, actually. We know that women who are pregnant and who then contract COVID-19 have a higher risk of being in hospital and a higher risk of death. So in fact, if you're planning a family, it's a good idea to be vaccinated. There is an evolving, very sad situation in South Africa of what we're calling COVID orphans, because moms who are pregnant get very sick with COVID-19, end up in ICU, and sometimes do not make it through. So pregnancy is a time when women are at increased risk of COVID-19. So in fact, vaccination before pregnancy and also during pregnancy is strongly recommended.
All right. Okay. Thanks for that, Doctor. I wasn't even aware that there's high cases of mothers losing their lives just like that, you know, and it shows the severity of this disease and the fact that we need to deal with it as soon as we can. Mabalani, what do you think the long-term effects of these lockdowns, right? We have lockdown level 3, level 4, we go up and down. What do you think the long-term effect will be of COVID-19, especially regarding the country's growth, will be long-term? Mabalani? Mabalani?
Hi, my connectivity. I missed that part. Can you repeat?
I was asking that, especially considering the fact that this virus has us going up and down lockdowns, what do you think this COVID-19 is going to have long term? What effects do you think it's going to have long term in our country's growth?
Well, I mean, we're already feeling it. COVID has just changed how life used to be. Some areas, it has forced us to do certain things that we had refused to do, like using technology as an enabler. We now have all of these various platforms that ordinarily we will be having them through people-to-people interface, which for us in the NGO world, were also expensive exercises. So we were able to do some things that ordinarily we would not have been able to do using technology. But over and above that, that's just a small benefit. The other challenges you have is on the economy. Many people have lost jobs. Businesses have closed down. I mean, the other day I was just in Braamfontein. Coffee shops, just those small eateries have closed down, and the impact that has on people's livelihoods, it has very negative impact. It's also in terms of how we interact with each other. The other day, we participated in the NEDLEC Rapid Response Technical Task Team. We had people from the entertainment industry, events, sports industry. They are not able to go on with their normal business because some of these sporting activities requires audiences to be there. And currently, in terms of the levels at which we are, some of the things that we used to have, we're not able to do them. There has also been reports around the impact that COVID lockdowns have also had a negative impact in terms of gender-based violence as well. The jury is still out in terms of the finer details around the linkage between the levels of lockdown and gender-based violence. But the other area that we're looking at is also around our rights and freedoms, as enshrined in the Constitution. The human rights impact that COVID has in terms of how we freely express, certain things that we used to express ourselves in. We know, I think when we got into COVID, the country's response was ill-advised, for lack of a better way, or actually not a lack of a better way. It was militarized. Can't force people through the army to comply. We needed to have done it a little bit differently than what was actually done. And I'm sure if we had done other things differently, then we would be in a much better position currently now, given the challenges that we are faced with. Because the conspiracy theorists have always said that we're being, channeled by government to do certain things, the third world order conspiracies and all of these things. So they fed into the steps that we're taking. But in the main, our freedoms are important, people's right to choose, including to choose not to be vaccinated. But as we have said, we don't want people to choose not to be vaccinated because the benefits, they far outweigh some of the challenges that people basically have identified. So yeah, life as we have always lived it has changed, and we need to adapt to this new normal. We need to ensure that there is an understanding by all of us why we can't do other things that we used to do, and now we need to do them differently. When we conquer, and I look forward to us conquering. We've seen there in Europe, as the doctor was saying as well, the more people get vaccinated, the more or the less the chances of people being hospitalized, people dying from COVID. Not that COVID will go away, but that the challenges will be much lesser. We want to get to that particular point. But when we get to it, a Kaizer Chiefs and an Orlando Pirates game must be attended at the stadium a little bit differently than currently it is happening. So yeah, life has changed, and we need to adapt, and we need to engage with each other to understand why we need to adapt, because December 2019 and January 2020, we were making fun. We even had songs about Corona. And then in March, we were in the lockdown. And since then, what we know now is not what we knew in March. And we continue to learn. The medical professionals continue to learn. But what is most important, it is just the human interaction, human interface that ensures that we have a better understanding that we are in a new normal that requires us to calibrate differently.
All right, okay, thank you for that. And perhaps a little bit of an unfair question there, Chris, just expanding on what Mabalani has just said. Do we think that are we ever going to get back to normal, especially now considering the fact that we're at a point where we're not actually really trying to reach herd immunity? We just want to get as many people vaccinated as possible. Is there a chance of us going back to normal?
I don't know if the way that we've been living before COVID is normal anyway. I mean, we've been destroying our own planet. We burn down forests, we pump out pollution, we do a lot of very dangerous things. So I think the definition of normal is quite hard to attach any real meaning to. I think what we have learned from the pandemic, hopefully, is we need greater personal responsibility for our public health. We need to think more of the health and safety and welfare of people around us. And I think that, building on what Mabalani is saying, I think that is one of the hidden sides of COVID-19, which we have to pay attention to now and in shaping a new society. And that's the impact of loss and grief, of so many people having died, so many families being left without parents or brothers and sisters, but also the personal grief, the depression, the anxiety that young people in particular have gone through. You know, the children haven't been able to play together because of fear of contracting COVID-19, that school life has been disrupted, that their parents may have lost their jobs. Their chances of getting jobs themselves are much lower than they were before the pandemic arrived. Those kind of societal challenges and the levels of anxiety that I think have been created by people being on their own for long periods of time, those have created quite deep wounds in us as individuals and as a society. And I think a key focus after the pandemic in shaping a new normal is how we get back in touch with each other and how we begin to reconnect as a society. Because what the lockdown has done to save our lives is to stop us from jolling, it stopped us from socializing, it stopped us from traveling, it stopped us from attending funerals. And the impact of that is deep and it's profound in a society where we are social animals and where we love interaction, as Mabalani is going to watch Chiefs and Pirates at the stadium rather than watching it on TV. All those things that have been lost, we have to rediscover. And I hope that we do that, and in the process, that we also develop different levels of tolerance, that we are more tolerant towards people whose views are different from us, whether it's on the basis of race, culture, religion, views on vaccination. You know, this has been an incredibly hard time, and we're going to have to reconnect as a society and rediscover the real values that keep societies together in the face of very serious economic tragedy. You know, so we're going to have to be rebuilding our country, rebuilding our economy, rebuilding our society, and rediscovering our soul. Those are huge challenges, but that's what we've got to focus on to find another normal.
Yeah, that's a bit deep right there, because it has had a serious impact on so many people's lives. And at this point, a lot of people are living in fear even, because the minute you hear that your mom has a cough or your mom is not feeling great, you just have that thing that it could be COVID, and especially with the rate of the number of people dying. Now, Aaron, do you think the rollout is making a difference? Now we go out and we train people and we say, don't be hesitant towards the vaccine. Are the attitudes changing?
In my experience, I have found that right from when we started training, people have been hearing about COVID, they've been hearing about vaccination. An appetite was already built over time for people to vaccinate. So there is a high willingness that I have seen. What I think is often mistaken for hesitancy is the idea that that intention to vaccinate is not translated into vaccination. And it's so easy to conclude that it's because people are hesitant. Not that there is no hesitation, but it is more about the infrastructure being available for people to vaccinate. You know, I live in a township whereby there is no vaccination site where I live, and there's hundreds of thousands of us there. We have to take taxis in order to get the vaccine. So recently there was a group called COVID Monitoring Group, and they organized themselves into a march that started. I think they are planning this for this week, a march from Maponya Mall to Bara to deliver a series of demands for government to bring vaccination close to the people. This particular incident or event seems to agree with some of the experience that has been shared with colleagues, that people are willing, people want to vaccinate, but the mechanisms of delivering the vaccination have not been improved. I think that if we just to focus on improving accessibility, just as we have a complex mechanism of collecting votes for people to be put in power to govern, we need to be having equally robust mechanisms of delivering vaccine to save people's lives. I think that's where the lack is. I still think that the resistance is very minimal. The anti-vaxxers are very small in number. But what tends to happen is that this lack of delivery, is quickly written off to hesitancy. And what will then do is come with draconian ways of forcing people to vaccine without addressing the real issue, is accessibility. Let's go to squatter camps, let's go to villages and make sure that we have means of delivering the vaccine that are safe but agile enough to reach where people are. The villages, where are mobile vaccine sites? That should be traveling across villages to help people, the farm people, the farm dwellers, as we call them. The towns are too far for people like that. And there's so many of them in those spaces. They are not able to get time off work, for an example, to go and vaccinate. So there is a serious shortage of delivery of vaccination. If sorted, it will change this picture of how we are looking at this vaccination issue, or hesitancy issue, I should say.
All right. Okay. Thank you for that. You're actually speaking to what Peter Benjamin is saying on the chat, and that's essentially accessibility thereof. But before we get into that, I just want to check with Dr. Kane Cross. There's a new variant that it was recently detected now, C19, and of course it's new, so maybe if you could just touch on it, but also let us know if we're going to need boosters, and what are we looking at in terms of boosters? Is it going to be like a single uptake, double uptakes, just to ensure that the vaccine actually works?
Yeah, thanks, Rufila. Yes, there've been a number of variants which are slight changes within the structure of the COVID-19 virus, which is still the same virus, but might interact with our bodies in a different way. So, for example, we know that the Delta virus is much more easily transferred from one person to another. It's much more infectious than the previous variants. This new variant that has been discovered, we are not yet sure what the implications will be in terms of how it interacts with people. But scientists are being very careful and watching as the virus changes, which is also called mutation, to make sure that we adjust our strategies accordingly. So, for example, with the first COVID-19 variant in South Africa, we saw much less transmission amongst health workers than we've seen with Delta. Levels of PPE and safety between one another. We don't know yet what this new variant will look like. The issue of boosters, you will have seen and read that some countries are already considering boosters to the vaccine. We don't yet know enough about how long vaccines will last for and how effective they will be over time to know whether or not we will definitely need a vaccine. I think in probability, it is likely that boosters will be needed at some point, but exactly the timing of the boosters and also the issue of equity around boosters. So should we be offering boosters to people in high-income countries with a very high level of vaccination already, where at the same time we know that, for example, in Africa, only 1% of all the vaccinations in the world have actually happened on the continent. So there's an issue of equity that comes into the booster debate. It's the issue of science. So when do we need to give the booster, who needs the booster, and so on, but also an issue of access to the vaccine globally. So if you vaccinate the whole of one country and everybody, and you have herd immunity, that's great, but you leave the rest of the world unvaccinated. In all those other populations, the virus will continue to be transmitted and will continue to change, in other words, mutate and have new variants come up, which ultimately could mean that your vaccines work, they don't work as well as before. So it's in the interest of everybody to make sure that we are all vaccinated as soon as possible, so that we don't have to consider that the virus might change so much that the vaccine doesn't work anymore, if that makes sense. So boosters are a probability in the future, but we don't know exactly when. And I think our task right now, and I like how Aaron is putting this, I actually agree with you, Aaron. I think outside of the urban centers and the sort of mobile and motivated people who want the vaccine, our issue beyond that is actually about access. It has to be right there in front of people, wherever they go, to a shopping mall or to a SASA, or actually to get their children vaccinated at a clinic. COVID-19 vaccine must be on offer immediately with no barriers. And then I think we will start to overcome some of those issues.
All right. Okay. Thanks for that, Dr. Peter is asking that if we don't think that the approach the government has towards the response of COVID could be from top down, and he's saying that he struggled to connect with people with vaccination. When all the info he asks for, he gets a list of sites. Some people get SMSs telling them to go many kilometers away from being able to have access to these. And sorry about that. And for many people to have access to these, how do we address that? And I guess this goes to you, Chris. Do we think that what we're doing is sufficient? Will we be able to get to a point where it's not, we are all working together? And I guess it takes us back to that question that I had earlier on about what we're doing as civil society in this space.
I think it's a very valid question, and I think it's unfortunate that you don't have someone from government to answer that question, because I think they would be better able. My sense, though, as I said earlier, is government was slow in developing two things: an effective vaccine rollout plan and an effective vaccine rollout communication strategy. The reality is it's been developed at central government level. It then cascades down to a province and down to our 280 municipalities. That can take forever. The reality is we need a healthcare system built from the bottom up. We need healthcare workers in every ward, in every village, in every township, and we need to empower them with the information and the vaccinations to be able to do the job properly. It's one of the many lessons we've learned through this pandemic. I worked at GCIS, the government communication system, for a couple of years, and we had a very strong focus on something called development communication, where you had in your community people who were able to act as a conduit between communities and government. That has all been demobilized. We've also had areas where there's strong civil society and health partnerships around HIV/AIDS, for example, where CCF played a critical role in the TAC. A lot of those were kind of either demobilized or didn't have sufficient funding. That's partly why it feels so distant. That's why it feels that it's a remote process that's going on. And I don't want to draw too many analogies with the July unrest, but I think what communities learned during the July unrest in Gauteng and KZN is if the state doesn't do it, you can do it for yourself. And communities stepped up increasingly during that process in a way that we might see, around vaccinations. I think if communities start to demand better public healthcare facilities and start to demand vaccines, we then move from being a passive society to a more active society. But that's something we could discuss for another 2-3 hours, is how the makeup of our society is translating into the vaccine rollout, the inequality, the logistics challenges that can't be faced, the budget challenges that government faces because of the digital vibe scam and others. It's a very, very complex situation. So that is my best way of answering that.
All right. Okay. Thanks for that. Mabalani, I think maybe this question needs a little bit more of an expansion based on the question that we spoke about earlier on about the vaccine being mandatory. And Lucas Morena is on the chat, is asking if a vaccine certificate or making vaccine accessible to people, would it be improper for they to have people have something to show that I've vaccinated when you're going into a conference, when you're going into church, into like big gatherings? Mabalani?
Yeah, I think, yeah, can you hear me?
Yes, yes.
Yeah, you know, when we do something, we get gratification either from getting the kudos for having done something right, or in this case of a vaccine certificate. So in the conversations we're having at NETLAC, I mean, we're fine with a vaccine certificate, using simple means that are available, so that it's also not discriminatory as well, in the sense that accessing it, because not everybody has smartphones. So whatever system is put in place must take into account that it must be for an entry level phone to a high-end phone. The second part of the vaccine certificate is not, it must be universal. It must not be discriminatory, because other people must not have unintended consequences of wanting a vaccine certificate, to use it now as a platform to actually discriminate others for not having a vaccine certificate. Because first things first, we need to get South Africans to understand why it is important to vaccinate and to vaccinate. Now, where we are in terms of the number of people that have fully vaccinated, where we are in terms of public education, where we are in terms of the issue Chris is talking about, making people take ownership of their lives, because whilst the efforts to get people to understand why it is important must be made by people also wanting to do it, the issue around the vaccine certification, whilst we support it, it must be based on an understanding that is written down in terms of policy. It must also not be used for nefarious means, where people will now use it to discriminate against others. But also we have different settings. I mean, the issue around the accessibility of vaccines that Aaron was talking about also is it's mission critical in terms of the issues around a vaccine certificate. You can't be denied to enjoy the freedoms and the benefits of every South African when actually vaccines are not available. Where I'm at home in Kaban, in Rustenburg, and around Rustenburg, there are villages. My sister comes from there, and I was talking to her. Where she is staying, they actually have to take transport to get to the nearest site, which is in Moses Kotane, next to Sun City, in order for them to get vaccination. Why can't we take vaccination to where the people are? Now we deny them access to the vaccine, then we say no, they are hesitant. And then on the other side, we also put a vaccine certificate as a means to allow them access to things that are their basic need. Imagine if you go to a Pick and Pay and they say at the door, if you don't have a vaccine certificate, you can't come in to go and buy food, and it might just be the only Pick and Pay available to you. So we need to make sure that we don't use this in a different context than what we currently are having. As a country, we have these challenges. We need to make sure that we get the vaccine to people, people understand, people respond, and then in the later part of this value chain, we can then come with those particular things in the way that it is being used in the north. But we're not there yet in South Africa. We have to deal with our socioeconomic challenges of access, availability, and ensuring that people take charge and ownership.
All right, thanks for that. Chris, Sandy is asking if we think mass media is doing enough in terms of making people aware of the benefits of the vaccine, and what more can be done actually. What more can mass media, mass communication platforms like TV and radio do to support government's communications response?
It's a good question. Some of the research I've seen shows that TV and radio are more trusted than politicians, sometimes more trusted than medical experts, although it's pretty close. So even if the media is in the top 3 trusted sources of information, that means they should do as much as possible. But we're not seeing that. I think sometimes the focus is on scare tactics and scandals. I think too much airtime is given to the anti-vax people. It is starting to change. We're starting to see media personalities, if you can call them that, getting vaccinated on air or in studio, which makes a difference. But I think the one neglected space is community radio. It has a massive impact. The difficulty is accessing the 130 or 230 community radio stations that exist. I think that's where people like ourselves and our civil society partners and government, labor and business also need to focus some attention. Coupled with making vaccines available, we need to make the information available on those community radio stations. But more needs to be done. I mean, I really, as I said earlier, it's all hands on deck, and the more the mass media can do alongside social media and face-to-face media, the more conversations we're going to build and the more impact we're going to have.
All right. Okay. Thank you for that. We've reached our time, and if I could quickly ask that we have our last says, what is it that you would like to part ways with to all of those that are listening? Aaron, you could go first.
Well, I would like to encourage that, we exercise our civil responsibility, our civic responsibility, and actually write to our councillors, our mayors, our premiers, and agitate for them to actually organize that the vaccination sites are multiplied, across our communities. I think there's an issue raised about whether our government is top down. Some of this needs to be bottom up. This is our government, part of holding it responsible is being able to raise to raise the right issues at the right time and come up with solutions for the problems that we are facing. So politicians, civil society, community action, something can be done to actually create forums and institutions that can deal with this multiplication of vaccination sites, so that it's not just, it starts with vaccination sites, but it can also become about the overall health in our community. Thank you.
All right, thank you for that. And Mabalani, last words?
Well, no vaccination site should turn people away, but also us as individuals, we must start with those that are closest to us. We must take them to the vaccine sites. We must make sure that they get there, and we must ask them to do the same to others, and that will have a multiplier effect. It must be met by a government being ready to ensure that when people want vaccines, they are available, and vaccines, don't wait for people to come to them. Vaccines go to where the people are. But in the main, it is for us to take charge of our lives, because this is about us. This new normal, I think as Chris was talking about, we must redefine what we mean by the normality. Things have changed, and we must do things the way that this pandemic has challenged us.
All right, thank you for that. And Dr. Cairncross?
Thanks, Rafila. I think I want to make 2 points. The first is that I think that we need to have vaccine promotion that happens in face-to-face contexts in communities with local community leadership. And by that, I mean community health workers, clinic and health committees, sports clubs, religious leaders, the people that are a trusted and known voice. That needs to be where we target our education, because they are force multipliers. And those are the people that should be part of developing local vaccine rollout plans. So the community takes ownership of how a vaccine rollout takes place within their context. And the second point I want to make is a sense of urgency. So I'm working in a hospital where we are still running 10 COVID wards and 7 ICU units for COVID-19, and we are not down yet from the third wave, and it is very likely that we're going to have a fourth wave. We have 3, maybe 4 months to get this right, to get to at least 50% of the population, to really decrease the height of the fourth wave so that we don't cripple our health system again, and we don't have the number of deaths and the amount of suffering that we've seen over the past 3. So that's my appeal for urgency on this matter, and thank you to everyone for their inputs and their campaigning.
All right, thanks for that, Doctor. And Chris?
Just very briefly, I agree with what my colleagues have said. Get vaccinated, make sure everyone you know gets vaccinated, and make sure government knows that it needs to make vaccines available. And thank you for hosting this. It's been very useful.
All right, thank you for that. I must say I had a couple of more questions because it's very interesting, this conversation, and we need to know as much as we can so that we're able to empower others. But unfortunately, the time has lapsed and we have to say goodbye. Thank you so much for availing yourselves and informing us on this very topical issue. Thank you and bye.